Good morning, Dr. Demito here. I wanted to give you a little overview of the assignment here in Module 5 because this is your first big project in Nursing 604 Population Health. And the basis of this assignment is social determinants of health. So let's talk a little bit about social determinants of health and what they are. I didn't know a lot about social determinants of health until a few years ago when the health system that I work for began to incorporate these social determinants into the care that we provide. So, what exactly is it? Well, the short version is how the social factors can influence a person's health and health outcomes. And we have some we have 5 listed: economic stability, education, social and community context, health and healthcare, neighborhood and built environment. Now, under each of these headings, we have some sub headings here. So when we're looking at our patient population and we're looking at the social determinant of health, economic stability, we're looking to see the impact of economic stability on our patients' health. Do they suffer from poverty? Are they employed or underemployed? Do they have food security and housing stability? Now, with our patients, we want to look at individuals and identify if any of these factors are an influence negatively on their health and health outcomes. The next category of education: high school education. Are they enrolled in higher education? Language and literacy, early childhood education and development. Well, when I look at this, I think as a provider, I know how important it is for early intervention in children who suffer from speech delay. So I know that I'm checking my developmental milestones on my pediatric population. And if those milestones aren't met, I am going to do what I can to get this child into an early intervention program. Now let's look at social and community context: social cohesion, civic partnership, discrimination, incarceration. So are your patients, are any of these subsets influencing your patients' health and health outcomes? And is there anything that we can do to help provide a filler in that gap? Health and healthcare. Do your patients have access to healthcare? Access to primary care? Health literacy. Do they fully understand? And this can be very difficult for patients with chronic disease. They may not have a concept that if you're experiencing kidney failure, that you have to watch how much fluid intake you bring in, or the importance of protein in your diet, or if you're diabetic, why you can't eat foods. Why can't I eat a potato chip? It's not candy. So we have to consider all of those things and how it influences the patient care that we provide. And I talk to you all like you are future nurse practitioners, because that's what your end goal is, right? So I want to align these social determinants of health as to how they will apply when you are working in the clinic as a nurse practitioner. Now let's look at neighborhood and built environment. Do your patients have access to healthy foods? In the inner cities, this can be a problem. There are food islands out there where people don't have ready access to healthy, wholesome foods, fresh fruits and vegetables. Perhaps the only access they have is the McDonald's that's on the corner. Well, that's not so healthy, is it? But perhaps we can fill some of those gaps. Quality housing, crime and violence, which is out of control, and environmental conditions. Just as an example, I live in the suburbs of Chicago. The city of Chicago, even though it's 2022, still has a huge lead paint problem. And so we do testing on all of the children in the city of Chicago before they enter school to ensure that they don't have lead in their system. So, are there environmental conditions, mold, that could be causing issues? And then it's our responsibility to try to provide our patients the tools they need to help alleviate the situation that they're in. Now, we're not going to 100% be able to help everybody, but as a provider, it's our responsibility to know avenues that they can approach if they choose to. Some people choose not to. They're happy with the way they are, they don't want to change their diet, but as providers, it's our responsibility to ensure that we do what we can to help these social determinants of health. So now let's get to the presentation. In your presentation, and I don't care what you can use Prezi, you can use PowerPoint, you can do a YouTube video. As long as you have covered all the criteria, that's great. If you're going to be using YouTube or Prezi, this needs to be a voice overview. So you're going to be giving us a lecture. So imagine that you are putting together a lecture on this content. Now remember, we've all gone to continuing education programs. Don't read your slides. Slides are supposed to include the key concepts that you're going to discuss. And as an example, I'm terrible. I critique every presentation that I'm at. I was at one the other day for some nursing leadership thing that I was attending. And I thought to myself, oh my gosh, she's reading the slides. I could do that. I could read the slides and save myself 2 hours from sitting in this presentation. I don't want to experience that with any of your presentations. So make sure that you have key components on your slides and that you are telling us a story. I talk a lot in stories. Tell us a story of what you're trying to tell. So state the 2 key issues you examined and the 2 determinant areas that they're associated with. Using your words and supporting evidence, tell us what these determinant areas and key issues mean. So give me your definition of what that means. Detail at least one intervention that has shown to improve each key issue. Now, interventions, how are you going to go and investigate this? You're going to do a search. You can use Google. Google has some really good searches, but your sites need to be legitimate. Avoid any sites that end in .com. When I see a site that ends in .com, I think to myself, they're for profit or they have an agenda. I want you to use sites that are .org, .cdc, .gov, .edu. Those are all good websites where you will get legitimate information. You can also research articles. Use research articles in peer-reviewed journals. Those are really good to use also. So I would use some peer-reviewed journals using a search engine. My favorite is Provost or Provid. Provid. And you can get some full text documentation. You can get access through the library. And number 4, why are these key issues important in health, and what does it mean to the people who are affected by the issue? And from a population perspective, since this is a population course, how does the issue affect other citizens who may not be directly affected by the issue? Could they be indirectly affected? How do your 2 issues affect the larger population? Remember to define your population, and population can mean national, state, county, or city population, and explain why you chose the population that you did. And here's a little hint: use public health departments, health districts. You can find a lot of wonderful data using those sites. Now, how long should this slide be, or this presentation be rather? it should be at least 15 slides. And the rule of thumb is if you're doing PowerPoint, a minute a slide. So you should be able to get all of your content in 15 slides. If you have to go over, that's okay. But I definitely would discourage you from doing a 30-minute presentation. It's just not conducive to do that. We want to keep them at about 15 minutes. And the title page and the reference page, they're not included. So essentially you're going to have 17 pages or 17 slides. Or if you're doing a YouTube video, 15 minutes. But that's the minimum. I want it to be at least 15, no more than 20. And you need to use 6 scholarly references, and you need to define what a scholarly reference is. Remember, I want them to be good, evidence-focused references, and cite them appropriately. Your very last page of your presentation will be an APA 7 formatted reference page. And make sure that it's APA 7. And again, you can use whichever avenue you choose to use. Now, I want to go over the rubric a little bit because I think this is important information for you. If you want to do great on a project or paper or whatever you're doing, follow the rubric. If you complete all of the tasks appropriately in the rubric, you should get a perfect score every time. When you're missing things, that's when you start losing points. So let's see. We have 2 issues from 2 areas. If you do that, 7 points exceptional. Now, determinant areas and issues, clear explanation of the 2 issues and determinant areas, definitions, expanded explanations, and meanings, uses scholarly evidence, your writing is clear and flows well. 10 points. Well, how do you start losing points? The explanation of 2 issues and determinant areas is missing. And so, see, each one you're missing a little bit of the piece. Now let's look at what's really important to look at. The big points. Population perspective. That's a 30-point. You don't want to lose any of those 30 points. The population being examined is detailed and issues affect or not supported with evidence. Okay, so you are going to be detailed when you are doing this because you want to get those 30 points. Let's look at the next one. Oh, this is a big one. 20 points. Neatness, visual appeal, minimum of 15 slides with content. So it's easy to read, not too much text. You use colors and graphics appropriately, and the presentation flows. So I can remember back when I first started writing presentations, I kind of went crazy with graphics. Make sure that your graphics are appropriate. You don't want too many. You want them to be appropriate. You want your presentation to be interesting. And you want it to grasp our attention and keep our attention. Those are very important components when you're developing a presentation. And APA, 7 points. If you have no errors, 5, 3 errors, and then so on and so forth. That's not something you want to lose points on. Those are easy points, so make sure that you get those. I hope that this little video has helped you and will help you be successful in the development of this assignment. If you have any questions or concerns about this, the first line is to go through your faculty. Your faculty are the best people to answer any questions or concerns or make any clarifications that you may have. If you're still not sure, send me an email. I can be contacted at ademito@toro.edu. Send me an email and I will do my best to try and help clarify any questions that you may have about this assignment. So have a wonderful day and good luck on your assignment.